Um, what's your name po?
By the way, I'm Dr. Lazel Coaching, an OB-GYN. I'm practicing an OB-GYN in private hospital, and sometimes I do my government service also.
I'll ask some questions lang po about teenage abortion.
Yes, okay.
First, what do you think of abortion po?
Well, abortion is any illegal practice that those women who had pregnancy and or rather an unwanted pregnancy, that they do any practices that without the consent of a parent or any consent of a doctor, by using of a drug or herbal medications that will cause miscarriages. In layman's terms, miscarriage.
What are the risks naman po of going through abortion?
There are many factors or risks that will cause abortion. Number one, it will cause bleeding, profuse bleeding to the patient. Also, it will cause also infection, especially if they submit abortion. They submit the abortion to those who are abortionists because they make use of some materials that is not really sterilized, so they will have an infection later. Not only that, if they took any medications that will cause them to abort the baby, sometimes it fails, and it will cause also what do you call this? It will cause the baby to have abnormalities. So those are I think the three major risks that will cause the patients risk, especially in their body. And of course, stigma also from the emotionally from the patient itself, especially the teenager. They felt that it will cause also depression for them, that they cause that guilt feeling.
So, pag kunyari, nag-take ka ng pills, like, there's a possibility pa rin for parang hindi ma-abort yung baby.
It depends on what pills. What do you mean, yung oral contraceptive pill? Or there are several pills, like now, can I mention the name of the pill?
Pwede naman.
Like for example, have you heard of Cytotec? Cytotec it's a medication that given to patient who had gastritis, yung may mga ulcers na tinatawag. But it so happened na na-discover pala yan na yung gamot na yon, once you take it, if you're pregnant, it will cause you bleeding. So that's why it was banned by the FDA, Food and Drug Administration. So, bale, wala na yan dito sa country natin. However, sinisell pa yan sa mga illegal drugstores, or actually, it's not illegal drugstores, yung mga nakikita daw nila sa mga churches, yung nakikita sa Quiapo, yung nagbibenta daw no, na you just take it, the medications, it will cause you bleeding. Sometimes you will not take it, sometimes you put it in the vagina.
Tapos ma-abort na.
Tapos ma-abort na yung baby.
What are the side effects naman po after aborting the baby? Like, physical and mental?
Okay. Physical, yung side effects niya is bleeding and infection. Yung dalawang yun. Kasi pwedeng magkukos ng blood loss, uncontrollable blood loss. Kung minsan, ang lakas na ng bleeding, akala mo menstruation lang yun, ilalabas mo lang siya, yun pala, hindi mo na napapansin, nag-anemic ka na, and then kung minsan hindi na sila nagsasubmit for check-up kasi natatakot sila. Pangalawa, infection. Kasi once na your cervix, yung belly na mates, kasi nilabas mo yung fetus, open yung cervix na yun, madaling pasukan ng infection, lalo kung wala mo lang antibiotics na binibigay. So, pwede talaga mag-cause ng infection din without being consulted to the doctor.
Yung mentally,
of course, it will cause also depression or parang may guilt, feeling of guilt. Kasi sometimes, alam mo naman na tao na yung nasa
Nasa
loob ng womb mo, and then it so happened na ikaw mismo, parang pinatay mo na yun eh.
yung
Oo.
guilt feeling.
Yung guilt feeling talaga, number one.
Does abortion affect you when you want to become a mother in the future?
Well, there is a little bit, depends on how you handle it later. But I think, of course, oo, parang may trauma ka na. There's a sense of, parang may trauma na yung mga teenagers na parang pag na-pregnant ako, baka naman ang mangyayari sa ginawa ko, pwedeng baka hindi natuloy yung pregnancy ko. And then may nangyayari kasi na actually it's really normal sa mga pregnant na may tinatawag like postpartum depression. Pero kahit hindi naman nagpa-abort before, after that, meron talagang postpartum depression because of the hormones. Eh lalo kung meron silang history, baka mag-aggravate yung postpartum depression nila later.
Pero like, kunyari po, nag-take sila ng pills, is there a possibility na hindi na po sila maging pregnant?
It depends on how they take. Kasi yung pills it should be regularly and in the same time. Eh sometimes, alam mo yung mga teenagers, hindi sila regularly dinitake. Once kasi nag-fail ka once lang, pwede ka ma-pregnant eh. So yun ang problem. Kailangan talaga, everyday, they will take it regularly.
Pero what if, kasi may nabasa po ako na parang, kunyari, you did it once po, tapos uminom ka daw po ng 4 times. 4 times, tapos after 8 hours, inom pa po ulit 4.
I think yung sinabi mo, that is an emergency pill. That is an emergency fertility pill. You take
It's
it
a
for...
way of abortion din po.
It's a way, one way of abortion na, like, if you have the sexual contact right away, within 72 hours, you should take that 4 hours, between 4 tablets in 24 hours, and then another 4 tablets. Actually, the effect is that headache, severe headache, may headache sila. Pero it is an effective way. Pero we don't want to encourage the teenager to take it. Paano kung next week na naman mag-contact na naman sila, they've been taking that every week na lang. So it will cause damage also to the system, ng hormonal system na. So it's not really advisable for frequent doing that.
Is there a limit for abortion?
Well, of course, even one abortion na once lang,
Yeah.
it's really, number one, moral issues. It's really against God,
Yeah,
diba?
it does.
Since I'm not only the illegal way, but since I'm a Catholic.
Yeah.
So, not only a Catholic, but it's there's a soul already in a 1 month.
Yeah.
Even 1 month, 2 weeks pa lang nga, in the start of fertilization stage, there is already a soul. So, parang hindrance na kagad na may isa pang abortion. Pero, multiple abortion will cause also na yung endometrium, yung lining ng mattress, magti-thin out. So, pwedeng later, maraming complications. Pwedeng, once she got pregnant, baka magkaroon siya ng mga complications like placenta acrita, didikit na yung inunan. Pwedeng baby, pwedeng dyan, pero pwede rin siya mag-premature labor. Maraming complications.
May gusto pa po ba kayo i-adapt
Regarding abortions,
Yeah.
what do you want to advise for those teenagers?
Opo.
Of course, abortion is very illegal. Not only that, moral issues aside, not only that, being a teenager who is pregnant, you should be responsible of it because you did it by yourself. Ginawa mo yun, so pananagutan mo siya. Pero of course, once you did it as a teenager, sana, after that, mag-rest for a while kasi maraming complications na maaga kapag nag-pregnant. Pwede kang early hypertension. Yun ang sinasabi, the earlier, the riskier, pero extreme of ages, actually, mas risk. So for me, sana in the right age, not really on the teenagers, yun
Huwag
lang.
po madaliin.
Huwag mo madaliin ang matres kasi it's too young. It will cause also, magkukos din siya ng cervical cancer later kasi maaga pa lang yung cervix, nabubugbog na siya. So, pwede rin mag-cause of cervical cancer.
Yun lang po. Thank you.
Okay, sige.